Welcome to the Plain English Public Health Weekly Report. I'm Richard Greenland, and it is Friday, May 8th, 2020. As always, there are links below the video if you want to look up any more information about what we discussed today. Starting off, we're going to talk about COVID-19, since that is the hot topic of the last few months. Right now, for statistics, we've got approximately 4 million cases worldwide, as well as 275,000 deaths approximately. In the United States, we have about 1.3 million cases, as well as about 78,000 deaths. In Europe, the UK, United Kingdom, has actually gone higher than any other country in Europe for number of deaths. They currently have over 31,000 deaths, and that is actually the highest anywhere except for the United States in the entire world. New evidence coming out this week suggests that COVID-19 was actually spread throughout, or at least was found in France and in the United States as early as December 2019, which was about the same time, weeks after or even days after it was first discovered in Wuhan, China. Right now, in the United States and throughout the world, many countries and individual states are actually trying to reopen or to relax restrictions around the COVID-19 pandemic. Going off that, here in the United States, the New York Times has actually provided us a nice set of graphs that show just which states are opening. In this first graph here, you'll see every state in blue actually shows the states that are reopening to one degree or another. On the second graph, the darker blue are the states that are reopening, but they do not meet the criteria that the White House has set forth for reopening. On the third graph, this is the most troubling graph, we can actually see those states that are reopening, but they have actually had an increase of cases over the last 7 days. That's definitely not something we want to see when we're trying to reopen a state or a country. Public health officials are warning that we do need to have better things in place, such as more testing and contact tracing before we really open up everything. In other news, many stores are requiring face masks for employees, and some are even going as far as to require face masks for customers as well. In Michigan, there was actually a store security guard that was shot and killed due to an argument over face masks. Also in the United States, because of COVID-19, there is currently a meat shortage. President Trump has actually signed an executive order to keep meat processing plants open because he says that it will, if the meat processing goes down, that hurts the infrastructure of the United States. Many unions and public health officials are warning that that may possibly cause the workers at those facilities to have a higher chance of becoming sick. One side effect of the COVID-19 that we are seeing is what is called Pediatric Multi-Symptom Inflammatory Syndrome. It's basically a disease that causes high fever, rash, abdominal pain, severe diarrhea, red eyes, conjunctivitis, and inflammation of the heart. It basically causes inflammation throughout the body, though the heart is the most concerning. So far in the United States, we've seen 85 cases of this, but no deaths. In the United Kingdom, they've actually had one death from this. As of right now, it looks like it is related to COVID-19, and it only occurs in children. Even though children typically do not get very serious symptoms from COVID-19, in this case, there are a few times that we've seen this pediatric multi-system inflammatory syndrome. Right now, it is still being investigated as it is not for sure that this is caused by COVID-19. Something else on the public health front that's related to COVID-19, but not necessarily directly, is the Well-Being Trust. They're a group that they estimated that the deaths of despair, and these deaths of despair are deaths that are caused by suicide or alcohol or drug abuse. They estimate that over the next 10 years, These deaths of despair will increase by approximately 75,000 due to COVID-19 and the lockdowns or stay-at-home orders, everything related to that. And this stresses the importance of balancing both the stay-at-home orders and social distancing and all that, as well as other things that we need as humans, such as being close to others and communicating with others. One thing that is not related to COVID-19, but still started, it seems, here in Washington State, just like COVID-19 seems to have started, is we are just getting word of these things called murder hornets. They are basically giant hornets. They're about 2 inches long, which is quite large for anything of that nature. They've got a reddish-orange face, and their sting is extremely painful. One person that was stung described it as having white-hot steel driven into your skin. Also, in addition to being very painful, it can actually be fatal if you get enough stings. Typically, a single sting will not kill you unless you're allergic, but even for those that are not allergic, if you get 20, 30, 40 stings, which sometimes happens if you stumble into a hive, this can cause death. The stings are also strong enough that they can penetrate normal beekeeping suits. These hornets actually came from Japan. The true name for them is Asian giant hornets, but everybody's just calling them murder hornets with good reason. As of right now, like I said, they're just in Washington, and they're working really hard right now to keep them from spreading. One other side effect, or one other thing these hornets cause, is the death of honeybees. These hornets go after honeybees and kill them, and so that can actually have a long-lasting effect, on the nature here in the U.S. and on our economy. As a last item of business for this week, there was also a chicken noodle soup recall for the Fresh Foods Market Classic Chicken Noodle Soup. It's sold at Kroger's, and the Best By date is 6/9/2020, and there's a lot code of 425-798-031120. The only thing wrong with this soup, there's nothing that'll kill you or anything like that unless you're allergic to eggs, because the reason they're warning about it is that the label on it was incorrect. The back label, where you normally have the ingredients, was accidentally swapped out for a different soup label, and so it did not include the warning about it including eggs. So if you have this kind of a soup and you're not allergic to eggs, don't worry about it. Just eat it. It's totally fine. Otherwise, if you're allergic to eggs, please do not eat it. Just get rid of it. And thank you for watching the Plain English Public Health Weekly Report. Please remember to subscribe and like the video.